In 1918, the world believed it was already living through the worst disaster imaginable. The First World War had turned Europe into a landscape of trenches, artillery craters, and mass graves. Entire generations of young men had been sent into battles that lasted months and killed hundreds of thousands. Governments were focused entirely on the war. Newspapers reported troop movements, naval battles, and shifting alliances. People assumed that once the war ended, the worst would finally be over. But something else had already begun spreading quietly across the planet. At first, it seemed like an ordinary illness. Soldiers developed fevers. Civilians complained about headaches and fatigue. Doctors saw patients coughing violently and assumed they were dealing with a particularly aggressive seasonal flu. Then the deaths started accelerating. Healthy young adults collapsed in the streets. Hospitals filled faster than they could admit patients. Entire households became sick within days. Some victims died less than 24 hours after their first symptoms appeared. Within months, the disease had spread across continents. By the time it was over, the Spanish flu would kill between 50 and 100 million people, a number so large that historians still struggle to grasp its full scale. To understand what that means, imagine a pandemic today killing more people than the entire population of France. And all of this happened while the world was already fighting the largest war it had ever seen. The early months of 1918 were chaotic even before the pandemic appeared. World War I had mobilized millions of soldiers from every corner of the globe. Troop ships carried men across oceans. Trains transported them between cities. And crowded military camps housed thousands of soldiers in close quarters. These conditions created the perfect environment for a virus. Historians still debate where the Spanish flu first appeared. Some researchers point to military camps in Kansas in the United States, where soldiers reported severe respiratory illness early in 1918. Others suggest the virus may have circulated in parts of Europe or Asia before spreading widely. Wherever it began, one fact remains clear. The global movement of troops allowed the virus to travel faster than any disease in previous centuries. Imagine if millions of people today were suddenly packed into ships, trains, and barracks, moving continuously between continents during a global emergency. That is essentially what World War I created. When infected soldiers traveled, they carried the virus with them. Within weeks, it appeared in Europe. Within months, it had reached Africa, Asia, and the Americas. The modern world had unintentionally built the perfect delivery system for a pandemic. Despite its name, the Spanish flu did not originate in Spain. The label emerged because of something far less biological and far more political: wartime censorship. Countries involved in World War I tightly controlled the information published in newspapers. Governments feared that reports of widespread illness would damage morale or reveal weakness to enemy nations. As a result, many countries minimized reports of the outbreak. Spain, however, remained neutral during the war and did not impose the same strict censorship on its press. Spanish newspapers openly reported the spread of the disease and even described the illness affecting King Alfonso XIII. Because Spain appeared to be reporting the epidemic more openly than other countries, international observers assumed the outbreak had begun there. The name Spanish flu stuck, even though the virus was already circulating across much of the world. The first wave of the pandemic in early 1918 was dangerous, but not yet catastrophic. Many people recovered, and some governments believed the worst had passed. Then the virus mutated. By the fall of 1918, a second wave began spreading with far greater intensity. This version of the virus attacked the lungs aggressively, causing severe pneumonia that filled airways with fluid. Doctors described patients whose skin turned blue from lack of oxygen. Some victims developed bleeding in their lungs and coughed up blood. Others died so quickly that medical staff could do little more than record the time of death. What made the Spanish flu particularly disturbing was the group it targeted most severely. Typical influenza outbreaks primarily affect the elderly and the very young. This virus did something unusual. It killed large numbers of healthy adults between the ages of 20 and 40. These were the same people who formed the backbone of the workforce, the military, and family life in most societies. In other words, the pandemic struck directly at the most physically resilient portion of the population. As the second wave intensified, Cities around the world struggled to cope. Hospitals quickly ran out of beds. Temporary medical wards appeared in schools, churches, and public buildings. Doctors and nurses worked exhausting shifts, often becoming infected themselves. In some cities, the death toll climbed so rapidly that morgues ran out of space. Philadelphia offers one of the most dramatic examples. In September 1918, the city hosted a massive parade to promote the sale of war bonds. More than 200,000 people gathered in crowded streets to watch soldiers march through the city. 3 days later, hospitals began reporting an explosion of flu cases. Within weeks, thousands of people had died. Modern epidemiologists often point to this event as a classic example of how mass gatherings can accelerate the spread of infectious diseases. Other cities responded differently. San Francisco, St. Louis, and several other municipalities introduced mass mandates, school closures, and restrictions on public gatherings. These measures resemble the strategies used during modern pandemics, demonstrating that many public health responses used today were already being tested more than a century ago. By 1919, the Spanish flu had reached almost every populated region on the planet. The virus traveled along the same pathways that had connected the modern world: shipping lanes, railway networks, military convoys, and migrant labor routes. The infrastructure that had accelerated global trade in the early 20th century now accelerated something far more lethal. Remote villages in Alaska reported entire communities collapsing within weeks. Medical records from the territory describe settlements where nearly every resident became sick simultaneously, leaving no healthy people to care for the dying. In some villages along the Yukon River, survivors buried neighbors in shallow graves before becoming ill themselves. Across the Pacific, isolated islands experienced outbreaks that move with terrifying speed. Ships arriving at ports carried infected passengers who appeared healthy when they disembarked, only to fall violently ill days later. In places such as Samoa, the virus tore through the population with catastrophic efficiency. Entire households developed fevers within hours of one another. Within a matter of weeks, thousands were dead. In India, the scale of the disaster reached levels almost impossible to comprehend. Overcrowded cities, weakened populations, and poor medical infrastructure created the perfect conditions for devastation. Historians estimate that more than 10 million people may have died in India alone, making it one of the worst hit regions of the pandemic. Contemporary accounts describe rivers carrying funeral ashes day and night as cremation fires burned continuously. Even after the guns of World War I finally fell silent in November 1918, the pandemic continued spreading with relentless momentum. While soldiers returned home to celebrate the end of 4 years of brutal conflict, many families found their reunions overshadowed by illness. Parades marking the armistice were followed by waves of infection as crowds gathered in streets and public squares. For countless households, the end of the war did not bring relief. Instead, it brought funerals. Unlike wars, which are remembered through battles, treaties, and political negotiations, pandemics leave behind a quieter but equally devastating record. Their history appears in hospital logs filled with names and dates. It survives in letters written by doctors describing wards packed with patients struggling to breathe. It lingers in family correspondence where parents mourn children, spouses mourn partners, and communities try to understand how so many lives vanished so quickly. These fragments accumulate slowly. At first they appear as isolated tragedies. Then the numbers begin to form patterns. Eventually the statistics reveal something overwhelming. By the time the Spanish flu finally subsided around 1920, the virus had infected roughly 1/3 of the global population. Hundreds of millions of people had experienced the disease. Tens of millions had died. In the span of just 2 years, a microscopic organism had spread across the planet faster than any army in history, and it had left the world permanently changed. The Spanish flu did more than overwhelm hospitals and bury millions. It shattered the illusion that modern societies were prepared for a biological catastrophe. Before 1918, most governments treated infectious disease as a local problem. Cities handled outbreaks on their own, often relying on outdated quarantine practices inherited from the 19th century. Medical science understood bacteria reasonably well, but viruses remained mysterious. Doctors did not even possess microscopes powerful enough to see the influenza virus itself. The pandemic exposed these weaknesses brutally. In cities across Europe and North America, hospitals collapsed under the sheer volume of patients. Entire wards filled within hours. Doctors worked until exhaustion, and then watched their colleagues fall sick beside them. Nurses who had survived the war suddenly found themselves fighting a completely different enemy, one that could not be seen, negotiated with, or defeated by artillery. In some places, the crisis grew so severe that ordinary civic function stopped entirely. Police officers were reassigned to deliver medical supplies. Volunteers dug graves because cemetery workers had fallen ill. Train stations and ports became silent as travel restrictions shut down movement between regions. Public health officials realized that the existing system, fragmented, reactive, and poorly coordinated, could not manage a pandemic of this scale. As the crisis unfolded, scientists began carefully studying how the disease moved through communities. They observed that crowded gatherings accelerated infections dramatically. They documented how closing schools, banning public events, and isolating infected individuals slowed transmission. Cities that acted quickly saw fewer deaths. Cities that delayed their response paid the price in thousands of lives. These observations became the foundation of modern epidemiology. Researchers began developing systematic ways to track outbreaks, analyze infection patterns, and predict how diseases might spread through populations. Governments expanded public health departments, funding laboratories dedicated to studying viruses and infectious disease. New ideas emerged from these efforts. Health officials experimented with early versions of contact tracing, attempting to identify who had been exposed to infected individuals. Public information campaigns encouraged hygiene practices, such as hand washing and avoiding crowded spaces. International cooperation slowly began to form as scientists realized that a disease crossing oceans could not be controlled by one nation acting alone. The world that emerged from the Spanish flu was medically different from the one that had entered it. Institutions devoted specifically to disease monitoring began appearing across the globe. Medical research intensified, eventually leading to advances in vaccines, antiviral treatments, and global health surveillance systems. Many of the strategies used during modern pandemics, tracking outbreaks, coordinating international health responses, and monitoring emerging viruses, can trace their origins back to lessons learned during those terrifying years between 1918 and 1920. In an unsettling way, the Spanish flu became a brutal teacher. The virus forced humanity to confront its vulnerability, and in doing so it pushed science and public health towards systems designed to prevent the next catastrophe. The devastation of 1918 did not only leave graves behind, it reshaped the way the world prepares for invisible threats. Despite its enormous impact, the Spanish flu often receives less attention in history books than the war that surrounded it. Perhaps this is because wars have clear beginnings and endings, victories and defeats. Pandemics unfold differently. They spread silently through ordinary life. They disrupt families, workplaces, and communities rather than battlefields. Yet the Spanish flu remains one of the deadliest events in human history. In just 2 years, a microscopic virus altered the lives of millions and reshaped global public health forever. It serves as a reminder that some of the most powerful forces in history are not armies or empires. Sometimes they are invisible. If you want to explore more stories about the events that reshaped the world, subscribe. The next chapter of history might be even more surprising.